Dear postgraduates, welcome to SNIP. Pseudoaneurysm or splenic artery pseudoaneurysm. In fact, this was a question that I saw, but then went back and prepared the answer for both, so that tomorrow you can have a renal artery pseudoaneurysm or whatever be it, you will be able to answer the question. It is a university question, short. Aneurysm is a permanent distension of a vascular tree. It can be an aortic or any other venular. So there is a distension. But then in that case, there is a weakness of the entire wall involving the intima, media, and adventitia. That all of you know. But in the case of pseudoaneurysm, there is an abnormal outpouching. Of course, there is a bulge, as you are seeing over here, but it is limited only to the adventitia. The media and the intima are rather intact. Sometimes what will happen, the bulge will be there, but it will be supported by the surrounding soft tissue. So these are all the features and the definitions of a false aneurysm. True aneurysm I have already mentioned. Courtesy ResearchGate for this particular picture. Etiology of pseudoaneurysms in general. It can be trauma. Any form of a trauma, it can obviously. It can be iatrogenic, it can be catheterization, or sometimes during a biopsy or a surgery. All of this, it is all iatrogenic. Mycotic due to infections. Acute and chronic pancreatitis, these are more important in the visceral organs. Myocardial infarction. Vasculitis, such as the giant cell arteritis, Behçet syndrome, etc. Takeios disease, SLE, and penetrating atherosclerotic disorder. All of this can be etiology for the pseudoaneurysm in general. The location is, it can be in any blood vessel, any artery, the arterial segment, or sometimes even the cardiac chamber. See, for example, they have quoted the femoral, carotid, or the visceral arteries. Pancreatic, splenic, and hepatic. So tomorrow when there is a question from any of these, you should not be bewildered. A limb artery, left ventricle, almost all have been mentioned as sites for pseudoaneurysm. Now this is a case report as such. So it is a 47-year-old gentleman who presented with an acute abdominal pain. And there is an early history of chronic pancreatitis. There have been multiple pseudoses. What they had seen is there are the pseudoses over here, but they had seen a bulge also over here. Contrast CT enhanced, it found out to be an expansile mass, pulsatile mass, therefore obviously it is vascular. And there are pseudocysts also, probably it could have been secondary to chronic pancreatitis. So this was a case report and this is a radiological CT scan. The methods of diagnosis and the treatment will be ultrasound. It will be showing a turbulent flow, yin-yang, and there is the risk of rupture. And the treatment will be by means of a surgical graft or so. Radiopedia, this is one of the references you people should follow. Now coming to our topic on splenic artery pseudoaneurysm. This was the exam question. So in this case, I am finding acute pancreatitis, chronic pancreatitis. All of this will lead to the release of enzymes which lead to the damage not only of fat leading to a pseudosis, but also to the other structures, including the adventitia of the blood vessels. Sometimes it can be because of the shearing forces. The diagnosis again is made by means of a CT scan, angiography. Therapeutic embolization can be a mode of treatment. What it is, I will be showing in the last picture. But please remember this word, therapeutic embolization. The sac is getting packed with coils. Sometimes surgical ligation of the blood vessel along with splenectomy and even a distal or a tail pancreatectomy can be performed. So this is one diagram that is showing the various locations in which a pseudoaneurysm can occur. So look at this, for example. This is a blood vessel and there is a bulge. Obviously, it looks like an aneurysm, but if they had performed a contrast, the vascular lumen would have been intact, but still there is a bulge. And what they do is they do a kind of coiling. So these are the coils that are inserted. This is one wonderful mechanism of treatment. Any of this, be it a berry-aneurysm or a pseudoaneurysm, probably they are able to do a catheterization, then approach the entire blood vessel, release a coil, and in this case, they will be creating a trauma to the intima, and the coil is lodged in place. Once it is lodged, it has got a tendency to clot and to result in fibrosis, and it will be producing a mechanical support. So that is. So CT scan angiography. Therapeutic embolization is exactly what it is. As I had mentioned, there will be a coil that is released which gets lodged in the case of an aneurysmal pouch, and it induces fibrosis, causing reinforcement and the strength of the vessel wall. Probably later on this will get absorbed. Arterial ligation and splenectomy are also indicated. So these are the references. I would like you people to kindly go through these articles. Thank you.